and restart our February advocacy meeting with Scott Darius and Florida Voices for Health.
Awesome. Everyone, thank you so much for bearing with me. Thank you. Good afternoon. So my name is Scott Darius, and I'm the Executive Director of Florida Voices for Health. The ARC of Florida have really been great partners to us, and so it's a pleasure to connect with you all any chance we get. And yeah, in this setting, especially with such a group of great advocates. Just real quick, for those who might be new to us as Florida Voices, we're a statewide nonprofit health advocacy organization. Our goal is really to make it easier for all Floridians to access healthcare, but I think especially those Floridians who are facing the highest disparities, and that includes our disabilities community. We do the work of policy advocacy really by working to build coalitions across the state. And so we're really fortunate to work with a lot of great partners. But I think at the heart of what we do, where we try to really contribute to all of the right to advocacy on any issue. I always say that it takes a lot of different people, a lot of different organizations with different skill sets at the table. And what we try to contribute to that space is really our storytelling. So we really focus on empowering those people who have lived experiences one way or the other with the healthcare system, empowering them to share their own stories, hopefully in those places where they can make a difference. And so really what I wanted to get through today, one, to kind of highlight our policy platform and some of the issues that we're working on behalf of Florida Voices for Health and with some of our coalition partners, but then to offer a couple of ways to partner with us in taking action, and then hopefully to hear from you all just, your general reactions to those things, but also always trying to find ways to support anything that you all care about and are actively working on this legislative session. And trust me, the slides are a lot easier to look at than this, but you'll bear with me. We know that the legislative process it's fully underway with committee hearings having happened and are happening right now, delegation meetings, which the ARC of Florida does a really great job of tracking over the last few months. And we've even found a way to technically squeeze in 2 special sessions even before regular session starts. And so now we're weeks away from the start of regular session. A couple of the policies, and Dean, I think I'm on slide, it's tough to say, but the policy platform slide, so like 4. Maybe I sent the old one. Yeah, naturally I did. So we can just jump down to values, basically. And so, yeah, we're weeks away from the start of legislative session. The policies that we're working on as Florida Voices for Health, we know obviously a lot of them won't move forward in this landscape, but we think it's important to fight for the things that matter. And to that, to that point, just to share a little bit more about why we're pursuing the policies that we've chosen. Just a quick look at our values, I think. It's first, I think we recognize that some communities face unique barriers that ultimately, creates this uneven system, this system of uneven access to care. And even in the same communities, right, there are some people who just don't have the same opportunities to get comprehensive care. And so for that reason, we really focus on policy and legislation that moves us towards creating more equal system in terms of opportunity for all Floridians to be healthy and productive. And then additionally, as an organization, we also believe that these policies should be fiscally sound, right? Fiscally responsible. That means that the policy either saves the state money or requires some moderate investment that generates long-term benefit. And then finally, we're keen on policies that benefit all Floridians, whether that's indirectly or directly. Next slide, please. So as we go into some of the specific policies that we're supporting, I'll weave in some general data that provides context on why we think that thing matters. And so we'll start by looking at the healthcare landscape for low-income Floridians, especially before kind of highlighting what I think will have, is an opportunity to have the biggest impact on healthcare in this state. Next slide, please. So I think we're still coming out of the other side of the pandemic in terms of our ability to capture good data, especially about who's uninsured in Florida. We just went through the unwinding process, and so I think that number is still generally in flux. But the most recent numbers available, we see that 11.2% of Floridians are uninsured, and that's still good for fourth worst in the nation. Unfortunately, some communities are disproportionately impacted by the high cost of health insurance. I think this is true in rural Florida, where the uninsured rate is 13% higher than it is in some urban parts of the state. And it's also true when you look at communities of color, who make up 50% of the thousands of people, tens of thousands of people who are left with no healthcare options whatsoever. And yeah, I think the consequence of this, of the phenomenon of the inaffordability of healthcare, is where you have a large percentage of Floridians who are either delaying or skipping care altogether because of those costs. Next slide, please. And I didn't get a chance to see who was on today, but I imagine a few of you have seen me present this slide before. But yes, there are nearly 500,000 Floridians who are left with no options for care whatsoever. And we're talking about people who earn below the poverty line, but don't qualify for tax credits in the ACA marketplace or for marketplace coverage, which is the program we have. For Medicaid coverage, which is, as you all know, the program we have for the working poor. And this is what we call the coverage gap. Now, the people in the coverage gap, right, are parents, caregivers, single adults who don't meet Florida's pretty restrictive eligibility limits. First of all, in Florida, you have to be a parent, right, like of a dependent child, or you don't qualify for Medicaid at all. And that's regardless of how little you make. But even if you're a parent in this state, to be eligible for Medicaid, you can't make more than 31% of the poverty level. And so for a family of three, that means about $7,000 a year is the most you can make and still qualify for care in this state. And so for those working parents, particularly those who are, working in fields that I think are the backbone of Florida's economy, right? Tourism and retail, construction. Those people who earn between $10,000 and $30,000 a year often find themselves squarely in this coverage gap. Next slide, please. But for the last 10 years, Florida's had the opportunity to change this. When the Affordable Care Act passed, it required states to expand their Medicaid programs to cover more low-income people. And then in 2012, the U.S. Supreme Court ruled that the ACA was constitutional, but they also made this Medicaid expansion component optional for the states. And, over the last 10 plus years, we've seen 40 states take up this opportunity, and Florida is one of the last 10 states to hold out. I always say that even if you accept the initial skepticism around Medicaid expansion, right? Like 10 plus years ago, when we first had the opportunity, I think in the time since then, we've been able to watch this experiment play out in other states. And I think it gives us a pretty good idea of what it might mean for us. Next slide, please. Yes. One of the biggest takeaways, right, is as we watch other states go through their Medicaid expansion, is that it fundamentally saves their states money. And according to our partners at the Florida Policy Institute, who, did that assessment here in Florida, kind of looking at the experience in other states and applying that experience to here, we see that we would save over $200 million a year. It doesn't surprise anyone that we have really a patchwork system of care. And once you kind of eliminate those patches and just comprehensively give people access to preventative care, especially, there are a lot of savings that come from that. The savings are also fueled by the fact that the matching rate, currently, for every dollar that we spend in the Medicaid program, 60 cents of that comes from the federal government and 40 cents of that comes from Florida. Under Medicaid expansion, to take care of the expansion population, the federal government would put up 90%. And we would put in 10%. So for every dollar, they put in 90 cents and we put in the 10. I think there's also all the other benefits that we get, the broader economic benefits, and never mind the additional $3 billion we would get just as a straight payment. That was a provision in the American Rescue Plan that was signed a couple of years ago. So yeah, I think the bottom line is it's fiscally irresponsible to not expand at this point. Next slide, please. And we've spent a lot of time. I talked a little bit about our story collection work and how that's at the heart of what we do. And I'll tell you, more than any other issue that we've talked about over the years, and it's even if we're talking to someone about mental health or someone comes to us to talk about prescription drugs or whatever it is, it's almost every single person who also has an oral health story. And so over time, it's just become a bigger and bigger part of our platform and the things that we talk about. Next slide, please. Um, yeah, and it's just to say that Florida oral health access in the state is one of those places, is one of those issues where Florida still has a long way to go. We have over 6 million Floridians who are living in dental provider shortage areas, and that's a number that's grown a lot over the last couple of years. And the widespread lack of access to dental care ultimately costs everyone unnecessarily. In 2021, so just a couple of years ago, which I think is the latest data we have, among all payers, right? And that includes Medicaid, private insurance, self-pay patients. We all spent more than $500 million on preventable emergency room visits related to oral health. So these are people who, a non-traumatic incident, something that could have been taken care of with prevention. We spent over $500 million taking care of that in emergency rooms. And for anyone who's familiar with that experience, you know that you don't really get treatment in an emergency room. You maybe get some drugs, some opioids or something like that, or antibiotics, and they send you on your way. And for people who can't access a dentist, ultimately it doesn't fix kind of like the root cause. And yeah, just a couple of things. We know that the Medicaid program, right, for the number of kids who are enrolled in it, there's still so many of them who don't actually get to a dental visit. And then for adults, where you have we're in a situation where currently for people who are 21 years or older, Medicaid only covers emergency dental services. So those things to alleviate pain and infection, which primarily means getting a tooth pulled. Next slide, please. So one of recognizing how important oral health is to our overall health, and in our in many ways impacts being it impacts our ability to be part of a productive workforce. One of the things we're working on is what we call the Smiles Act. We've rebranded it as a Smiles Act, and it basically is to expand Medicaid's adult dental benefit to be more comprehensive, right? So to cover all the things that Medicaid currently doesn't for adults, including routine diagnostic care, basic dental services like cleanings and x-rays, and major dental services like root canals and dentures. We actually commissioned a study a few years ago from the American Dental Association's Health Policy Institute. And what they found is that at kind of its peak in year 3, the total cost would be about $1.65 per month per enrollee to take care of that population. So I think about $29 million. The thing is, right, there's a broader economic benefit to it. Even with that moderate kind of investment, you have, the additional economic activity to the tune of $223 million a year. And that stems from, people, well, first of all, the money we save in emergency rooms, right? Like not paying for a lot of care in that particular spot. But also, as we've talked to people over the years, one of the things that jumps out at me when it comes to oral health is how many people retreat from public life, right? Whether that's work or school, people who are so self-conscious about it because, we live in the world that we live in, or people take different jobs, right? Like become underemployed in a sense because they're so, I don't know. You feel the stigma of having, right, like less than great teeth. And so there's this broader additional economic activity that we always talk about. And, another kind of updated piece to this legislation that we've put together this year, it also includes an increase in reimbursement rates for providers. We know how few dentists and medical providers overall take Medicaid in this state, and it's in large part because of how low our reimbursements are. Florida actually ranks 49th in the nation when it comes to Medicaid dental reimbursement. And I think typically only pay out about 42% of the average fees charged by dentists. So currently, just to give an update on this particular bill, we're talking to a couple of legislators to secure sponsorship. It's gone through the drafting process, and we actually have Acadia, our advocacy directors, up in Tallahassee today to lock in a couple of sponsors on the House and Senate side on this bill. So hopefully, yeah, we'll have a lot more to talk about in the coming days. Next slide, please. There's also, related to oral health, this bill that this policy opportunity that came to us through some of our partners at the University of Florida's College of Dentistry. So since 2021, right, you've had many school districts that have interpreted the Bill of Rights, the Parents' Bill of Rights, to pass to require active consent from parents to get health screenings. Now, I think we all remember health screenings from school where you just, for your vision tests, you hold your hand up to your eye. For your mouth, they kind of just take a quick look with a mirror, right? Nothing really terribly invasive. Scoliosis, they'll check for the curvature in the back. But the Parents' Bill of Rights, when it passed, it didn't make this kind of distinction between those routine, non-invasive health screenings and more invasive health procedures. So, for example, like we talked about, a dental screening is really just the quick assessment, checking a mouth with a mirror. But we all know how difficult it is for parents and schools to get things signed by parents, right? I can only speak for 10-year-old Scott, 10, 11-year-old Scott, and just to say that the form probably wasn't making it to my mom unless it was a field trip. And a particularly, it had to be a good field trip at that for it to get there. So just to say that although the law, the way it's written now, it's kind of vague in terms of what's required, a lot of school districts have taken this approach of requiring, a signed document before they'll do the screening. And I think that's led to what we estimate as a 43 to 62% decrease in dental screening participation rates throughout public schools. And I think it's this phenomenon that's really feeding into the kind of high rates of cavities that kids are walking around with, the high rates of missed school days, but also the high rates of care that we're giving in emergency rooms because we're not really connecting people to preventative care when we can. So with this bill, it's pretty simple. It just looks to clarify that particular piece and say that schools can opt to do passive consent for those non-invasive health screenings. We actually got that legislation filed, SB 219. These aren't the updated slides, but it's House Bill 219 and Senate Bill 370. It was filed in the House by Representative Skidmore and in the Senate by Senator Sharif. So we're working on that with them, and hopefully, is a thing that we can see move forward. It's actually had pretty strong bipartisan support in the conversations that we've had so far, and so we're encouraged by the progress we can make there. Next slide, please. So, our growing relationship with the ARC of Florida, I think, stems from the work that we've been doing on disabilities issues over the last couple of years. And just to say quickly that it's really been our honor to work alongside you all and other amazing partners in the space who are just trying to do right by this community of Floridians. Next slide, please. So on that front, just to tell you something that you already know, that we as a society, I think, generally don't do nearly enough to ensure that members of the disabilities community live up to their full potential, right? Florida has a slightly higher rate of individuals with disabilities than the rest of the country, and still we continue to have, a list of people waiting for access to home and community-based services. And we all know just how long it takes to get off of that wait list. And just to acknowledge that some of you yourselves or family and friends might have people living through that, really difficult situation right now. And the truth is that the wait list and other issues like that persist in large part because it's just an area that we don't fund as a priority in Florida. We rank 49th in per capita spending on services for people with disabilities. Next slide, please. And so considering all of the health access issues impacting the disability community, we know that there's really not one single piece of legislation that's going to plug every hole in the system. One piece of the solution that we're really excited to be working on with a great set of advocates is this bill, the Medicaid buy-in bill. Due to the low income threshold for Medicaid in our state and the fact that we haven't expanded, we know that some Floridians with disabilities find themselves making a really difficult choice to either retain access to care through Medicaid while remaining under or unemployed, or pursuing those employment opportunities and losing access to the comprehensive coverage that they get through Medicaid. So this bill that we're working on with Representative Rita Harris would require the ACA, so the Agency for Healthcare Administration, to establish and implement a Medicaid buy-in program for individuals with disabilities between 18 and 64 whose incomes exceed the maximum income eligibility limit, which I think for people with disabilities is about 88% of the poverty level. And funny enough, this isn't some novel idea. I think this is one of the things that jumped out at me when we were first kind of asked to partner on this. Florida is actually just one of 6 states that doesn't currently offer a buy-in plan or the opportunity for people with disabilities to buy into the plan. So just to say, it's not so unheard of. Next slide, please. Now, what we found in our work, talking and connecting to storytellers, I think it's that there's this major issue that sits at the intersection of disability and oral health. So the last 2 things we've talked about. What we've heard and what's been confirmed by study after study once we started looking into it is how difficult it is for Floridians with disabilities to access dental care specifically. In a recent report, the CareQuest Institute found that generally throughout the United States that individuals and households experiencing disability visit their dentist less frequently than those that aren't, right? And I think that's driven by a couple of different factors, including the limited availability of providers, the high out-of-pocket costs once your insurance coverage runs out or once you become an adult. There's also sedation and anesthesia that's not available a lot of time for adults who might need them, who have other comorbidities and things like that. And then just general accessibility, being able to get into a dental office and finding providers who are willing to accommodate whatever the disability is. Next slide, please. So like we talked about with the SMILES Act, Medicaid has very limited coverage for dental services for adults, right? For adults, like we said, Florida Medicaid will generally only cover getting a tooth pulled. And individuals with disabilities often need more comprehensive care, which isn't fully covered. So working with Representative Angie Nixon in Jacksonville, there's a bill that we got through drafting and should be filed either later this afternoon or later this week as a pilot that would expand the dental coverage benefit for adults with intellectual and developmental disabilities to include preventative and restorative care. So everything that the SMILES Act would do for the broader adult population in Florida, we're also working, right, if we can get it, because there seems to be some momentum to address this issue, at a minimum, this pilot program to serve adults with IDD. Next slide, please. Now, we also know there's this challenge, right? For those families that are able to find a dental provider that's willing to see them, comfort and familiarity, I think, are one of the major factors of having a successful visit. And I think, one of what we've learned, what we've seen in literature, and even just talking to providers, we held a roundtable a couple of months ago, and for a couple of providers who were there, they shared that you often can bring someone in for an introductory appointment, give them a chance to get used to the surroundings, to see the tools and things like that. And just, how far that intro appointment goes to a successful relationship with the dentist long term. Now, Florida, like I mentioned, Florida Medicaid, and I think a lot of the other insurance plans really don't cover that appointment, even though it requires time and resources from the office and from the dental provider. So basically what we're offering here, and we've had a couple of conversations around this, but it's not something we'll see this legislative session. It's to introduce this billing code that would allow dentists to have that intro appointment and be reimbursed for it at some level. And it's not a lot, but the reimbursement wouldn't be a lot, but at least it signals this willingness to serve this population and maybe starts to bring more people in. Next slide, please. And so finally, just a couple of big issues that we're looking at overall that we'll be amplifying over the next couple months. Just related to disability specifically, we know that some of our partners in the space are monitoring the rollout of the Medicaid managed care plan, Medicaid managed care pilot for people with disabilities. So just being a partner to track some of that, we may put out a survey in a couple of weeks to get a sense of how that's playing out. And then, again, just to voice our commitment. I think any space that we get into or we talk about disabilities access for care, disabilities access to services, we'll always lift up the need to just eliminate the wait list. Whether or not it feels plausible or something that'll happen, it's just something that we always plan to give voice to. We've also been really fortunate to work with the Florida Community Health Worker Association as they work out to build more support for, this, I think, an undervalued part of the workforce. So really working to get the things that they provide to the communities they serve, to have them reimbursed through Medicaid. And then there's the work that our partners at Floridians for Dental Access are doing around dental therapy. For those who don't know, dental therapists are basically a mid-level dental provider. And we think by adding in this new workforce, creating a pathway to this new workforce, it will allow us to address that 6 million people who are living in dental provider shortage areas. And then finally, we have not finally, but just to call them out, the Florida All Copays Count Alliance. They continue to work on eliminating the practice of insurers who double dip on the costs that they recoup from prescription drugs through those prescription drug cards, basically. And then we're always working to support our partners at the Florida Health and Nutrition Coalition, who are working on a bill to advance the prescription of food, right? We know that good food, especially in a medically prescribed way, believe it or not, can go a long way to improve health outcomes for a lot of people dealing with diabetes, and any number of other chronic illnesses. So it's a growing movement and we're excited to support them in that work. And then last thing as I land the plane, before we get into some of the action steps, just to point out the elephant in the room, which is some of the things happening at the federal level. Next slide, please. And it's hard to say exactly what will happen when it comes to healthcare and what impact that might have on the state legislative process. But I think on some level, right, we know that we'll have to defend programs like Medicaid from cuts specifically. And despite the challenges of the program, I spent a lot of time talking today about the ways we can improve it, but we know that it's a critical source of care for children and pregnant women and for people with disabilities. And just to say that some of the policies that have been discussed include cutting the matching rate for Medicaid expansion or just cutting the baseline matching rate for Medicaid overall. We've seen some conversations around block grants and per capita caps, basically models where you don't provide funding to the states based on the level of need. You just assign a set dollar value and say, states, you have to work within this amount. So in a block grant, for example, right, you say, hey, Florida, you get X amount of dollars, you have to stretch it to work for you this year, regardless of how many people sign up for Medicaid, regardless of what level of services you provide. And typically in response to that, right, to make it work, you end up in a place where, people start limiting what services they provide or just start limiting who's eligible for Medicaid overall as a way to make that money go as far as it needs to. And then, finally, there are all sorts of tactics, I think, that might start to impact how people enroll in comprehensive private coverage. I think there are very real threats to the navigator funding, and we know how important they are to making sure people get connected to marketplace plans. And we've already seen efforts to expand the use of short-term plans that really circumvent a lot of the ACA requirements. To make sure people are getting the value for what they pay. Next slide. But even there, there's a lot going on, but it's not to say that we're without hope. We still have a say in what happens, I think, at the state and the national level. And my hope is that we can all work together to make these health systems work better. Here are just a few quick ways to get involved. Now, this is where it's going to get a little dicey because my slides, I don't think, match up exactly with what we have, Dina. So let's just push ahead. We'll see how far we get. The first thing I have on my slide is just to encourage you all to share stories, right? I think that story collection work is something the ARC does really well and is continuing to do. And I'll say for us, as we do advocacy, especially at the federal level this year, to really speak to the value of Medicaid and how helpful it is for children and pregnant women and people with disabilities. We're just hoping to highlight that a lot more. And so if you have a story that you're willing to share, if you're willing to be a part of that advocacy, if you're willing to go up to Tallahassee or, dare I say it, DC, please feel free to reach out and we can work together on that. Would love to also, maybe this is my pitch to Dina and the folks at the ARC of Florida, would love to partner on, having a visible presence this year, both at the state and national level. Okay, hold on. The other thing I was going to invite you all to do, as we go into, I talked a lot about the different policies that we're supporting this year, and I'll share a link I'll share the actual slides that I'm looking at, but we have a digital action center that you can find on our website at healthyfla.org. If you look under the Get Involved tab, basically we have a place where you can take an action on any one of the issues that we've talked about. You can send your state legislator and actually members of Congress a quick letter. You can make a phone call, or you can post at them on social media. And so just a couple of quick ways to take action if you're so inclined. Now, so Dina, I'm going to say go one slide up, and then we're going to double back real quick back to this recap slide. My bad, I meant forward. This is where the chaos kicks in. There we go. Just wanted to invite you all. We have what we call the Florida Voices for Health Advocacy Collaborative. And it's really a space where Floridians can come together, right, on a lot of different issues, where we share updates on what's going on. We let partners kind of share updates on initiatives and things that they're doing. We provide trainings related to how to share your story, how to power map your legislator, just really practical things like that. But also we coordinate actions to do visits up to Tallahassee. So we know legislative session starts in a couple of weeks, that first week of March. Our plan is to be up there basically every week through the first six or 7 weeks on the Tuesdays and Wednesdays, just bringing teams of people around to meet with their different legislators and to support our different issues. So again, if getting up there is something that is exciting to you, we'd love to have you. We also do virtual visits and things like that, letter writing campaigns, and like I mentioned, the digital mobilizations. But just to swoop back a little bit as I really try to sell you the timeshare here, just to give you a sense of what we were able to accomplish last year, right? This group of folks that Acadia, our advocacy director, works with. Together we spoke at many delegation hearings across the street. It was either us or our partners. We actually coordinated over 100 different meetings with legislators and their staffs over those couple of months of session and committee weeks. We had 10 different visits to the Capitol each week. And dare I say it, we had for as often as we go, we don't really get recognition, like big recognition from legislators. But the one time we brought medical students, these guys were falling over themselves to ingratiate themselves to these kids. And so they actually got a shout out from the House floor, these med students. And so we do a lot of, I think, exciting things, things that move the needle. We were very fortunate to work with JJ last year as he got called down to the House floor and really, yeah, actually able to achieve some wins for Floridians with disabilities. And just to say, I think that's the way we see our work. In some places we lead, but I think where we really see our value is just supporting you all, the people who want to do this work, to use your own voice to accomplish the things that, yeah, are doable. And so, yeah, I hope you see us as just a resource to whatever it is you want to do and want to accomplish. 2 slides down now. So again, just kind of looking at our calendar for the rest of the year, we have a couple of days, like I mentioned, we'll be up at the Capitol mostly on Tuesdays and Wednesdays this year. We know the DD Day is a big one that happens right every year, and so we'll be there in solidarity. And again, you just let us know how we can be helpful, and we'll be there. But then, yeah, we have a couple of other kind of like issue days where we're bringing folks, but it doesn't preclude anything else, right? Even if we're there on an oral health day, if that's the week you can be up there, we'd love to have you, and we'll talk about whatever issue feels good to you. Now, if that's something you are interested in, you can either just get a hold of me directly, like I'll share contact information, but we also have this form that you can fill out to get, yeah, to give us a better sense of what it is you need, what kind of support you need to be up there. We help by providing some support for travel and for lodging and for things like that, and really just try to make it as easy of an experience for you all as we can. Next slide has just a list of trainings that we'll be doing over the next couple of weeks. So yeah, you can see we'll do how to share your story and advocate for your cause. We have a power mapping one coming up in a couple of weeks, first week of March, and then how to effectively talk to your legislator and do media outreach and things like that. So yeah, we hope that you'll join us for any one of those. I should also mention, we just announced earlier this week that on May 7th and 8th, we'll be having our annual Florida Voices for Health Summit. Our keynote speaker is Dr. Jamila Michener, and it'll be in Lake Mary, Florida. So yeah, for anyone who's been there, it's a really good time to meet, I think, just the statewide network of advocates, people working on a lot of different issues. We use it as a chance to educate and catch folks up on what's happening. But for me, it's really about deepening relationships and getting to meet more people. So yeah, we hope that you'll join us. Next slide, please. For folks looking for other ways to get involved, Medicaid expansion, although we're working on it in the legislature, being realistic, don't think that's going to happen in the next year or two. So simultaneous to that, there's a campaign to put Medicaid expansion on the ballot in 2026. Florida Decides Healthcare is the name of that political committee. Right now, our goal is 1 million petitions, and our deadline to collect those is next February. So February 1st, 2026. Volunteer signature collection has already begun. You can actually go to the website and request a pre-filled in petition that'll be sent to you, and all you have to do is mail it back. Yeah, so there are ways to plug in. If if you're looking to be a community hub, we're also looking for those. And that means folks who are willing to have the petitions, and people in your local community can come pick them up from you and drop them off. Yeah, also, if you have a cool $10-12 million lying around and you want to donate to the campaign, we will also take that. Next slide, please. For I think one of the slides that's missing here, on oral health, if you are interested on the oral health piece, we do lead a small coalition, not small, but it's a coalition called the Florida Oral Health Alliance. And it's in that space that we're actually doing a lot of the advocacy around disabilities access to oral health. And so if that's something you're interested in, I'd encourage you to check out healthyfla.org/FOHA. And then finally, yeah, for those who are interested in staying plugged in with Florida Voices for Health, go to the website, feel free to subscribe, feel free to join any one of our coalition spaces, or reach out to me or Acadia directly, and we're happy to kind of give you a lay of the land and all the different ways that there are to plug in. I'll stop there. I'll say thank you for bearing with me and these like technology difficulties I'm having over here. But yeah, just really appreciate spending the time with you all.
Well, we appreciate it. We have a few minutes. We can open it up for questions. Does anybody have any questions for Scott? Comments? When we send out the version of his presentation, we will include his contact information. So you can reach out to him directly, but if you have any questions right now, this is a good time to do it. Or you can put it in the chat and we can do it that way.
Or I'll ask you all questions. Interested to know if anyone's planning, if anyone on the call is like already planning to be in Tallahassee or have like a particular issue that they're, yeah, passionate about or want to do advocacy around.
Well, we will be there for sure.
I was going to say, so I'm
Yeah.
Missy Olive. I'm the executive director of the Florida Association for Behavior Analysis. You know, the behavior analysis services started into managed care on Saturday. And so everyone is watching on pins and needles. I think the COC for most people is 90 days. Two of the payers or health plans have extended that to 120 days. But I think the worry for families is what happens when my provider is not in my health plan.
Yeah.
And so there's a lot of worry about that. So right now we're just sort of watching and waiting.
Interesting. How are you all tracking some of that? Just kind of waiting to see what comes in.
We've received a lot of emails. Most of the emails were from providers. We've gotten one or two emails from families. And then 10 Tampa did a little 2-minute blurb on Friday about that. It's just confusion, right? It's a lot of confusion. And so just helping get the word out that they don't have to change their health plans right now, but that at some point they're going to have to pick what's the plan that's right for my family. And that might mean a change in provider or even alternatives like asking for a single case agreement so that they can keep their provider, you know, for a period of time.
Yeah. No, it's how devastating confusion can be in these systems, right? Like, yeah, how many people fall through the gap, fall through those cracks because of confusion. So no, Allison, Missy, I'm sorry, you will be hearing from me. Yeah. Awesome.
Anna, did you have a question?
Hi, so my name's Anna Meaches Dillon. I am family advocacy and outreach for the Arc of the St. John's. I'm also chairperson of Family Care Council Area 4, and I run a resource directory for Northeast Florida. And my biggest job of all, I'm a parent.
Anna, do you have free time? What do you do? Yeah, how do you?
No, but FND did teach me about some AI stuff that I can help to do my 500 jobs recently. So I'm excited to try to implement that. But we've been, we have a free charter preschool on site here at the Arc of the St. John's, which is very rare. Most of the ARCs don't have pediatric services. We also house an ABA program that runs alongside, but is separate, which gives us this amazing opportunity to really utilize a transdisciplinary approach without some of the financing blocks that you would have in a private practice, because we can both utilize our ABA program for families that are taking advantage of that, as well as our education program, which is a free public education program based on IEPs. Then we also have the backing, of course, the ARC organization behind us. We're right here on campus. We do a family advocacy aspect to that. And we're also, pushing into supporting some of the families that don't fit within FSDB, for example. They move here, they have autism might be a diagnosis along with dually impaired. There's all these different areas where we're kind of bumping in and finding a lack of resources. And then we created a space here for early steps as well. So how do we support some of those families who are not available? They don't have IEPs yet, right? They can't qualify until they're closer to 3. So we're looking at ways to provide ABA services for them, because of course most of these kids can't go to daycare or they've been kicked out of every daycare. But what I'm finding is we have families who have aged out of our program, and the behaviors are so severe that every ABA program locally has kicked them out, will not serve them. And they're reaching out to me, and I if I had more space, I would serve all of them, right? I would take every single one. If I had space and I had staff, I would do all the things, right? But so the other side of that is, and it leads into this expansion and these changes and all of these things I've been asking for years. I've made it part of my legislative ask every year. I would like CMS to be a full pay option under kid care. Now, that's not to say that CMS is perfect. It's not. But I have to start somewhere. If I can get you to make it a full pay option that is available to every single family who medically qualifies, well, I start there, and then I start honing in on how to make it work for families and ensure that providers are covered and we're able to have behavioral services in addition to OT, PT, speech, everything working together in collaboration, music therapy, all the things, right? I would love to see some focus, and we focus obviously on adults, and my son's 10. We're heading towards that. But at the same time, if there's no focus on all of these gaps that keep growing larger and larger for our early childhood, middle childhood, and then into this middle school range, that's where we end up with adults who we're then reacting to a crisis versus avoiding the crisis altogether. And that's not to say that every individual is not going to still have challenges throughout their entire lives. They very well may. My son's been in therapy his whole life. He still has behavioral challenges. It changes, right? But I'm in a position where right now, if his provider were to not be in network with his insurance anymore, there are no other providers to fill that gap. There is nobody else. Nobody's going to take a 10-year-old with the behavioral challenges he has. Nobody's going to take that on.
I missed the beginning. Where are you?
I'm in St. Augustine.
Okay.
Yeah, so I'm in the Arc of the St. John's. I'd love to be in touch, by the way, because we're working towards a lot of the same things. Which, Dina, I'm actually going to send you the one-pager that Kathy and I included in our legislative packets this year at the delegation, and it's based around that ask for CMS being a full pay option. But I would love to get some support in moving forward with that. If that's possible. I don't want to put anybody out, and I'm not going to overshadow the issues to serve our adult community. I work on that as well. But I'm just seeing these gaps grow bigger and bigger and the funding be cut. And then now we're trying to navigate with our families who are receiving ABA, all these changes. And, commercial insurance is even more difficult. What do we do?
It's one to speak to that phenomenon about our healthcare system overall, where we just so often, I don't know who to blame, but who I will blame are the people who make the rules, right? It always feels easier to take care of, to do the thing at the end, to do the thing that is kind of on the periphery, and after a problem, for whatever reason, we don't invest in prevention. We see that as a waste of time and things that we can do upstream that would save us in the long run. So just to say, I hear you on how that phenomenon plays out in any number of ways. Two, if you're looking for a community support, I can't wait to see the one pager, and maybe we'll just set up some time to talk with our advocacy director and game plan with you a little bit on how we can support and how to maybe position that particular bill or piece of legislation. But what I will offer now is this idea that, when we build these teams of people who show up to Tallahassee each week, it'll be someone who has an oral health story, a disability story. It's people from every end of the issues that we come together. But why I enjoy it so much is everyone there fundamentally understands the value of showing up as one, right? Regardless of the issue that brought you to the space. And so we it takes a little planning ahead sometimes, but in every meeting we sit with in a legislator, we find a way to connect all these issues that feel so disconnected and give everyone the floor to talk about what it is that they want to talk about. And then kind of based on the reaction of the legislator, we see which one they're like most biting on or whatever it is. Or if we strategically went in to like get this one person on one thing, we might like adjust around that. But everyone fundamentally is like to talk about all of the issues and to stand in as a support for, whoever came to the table with the one thing. So just to say, that's not a concern on our end. If it feels like it's not an exact thing that we talk about currently, come on down. Yeah, would love to partner.
Right. And I feel like it's all part of the experience, right? We need to be providing support at all these levels so that we can, let's avoid.
Yeah.
Thank you.
Anna, I'm writing names. You will all hear from me.
Looking forward to it.
We are right at time, so we greatly appreciate Scott taking some time to talk about your advocacy and where you're going. So again, we will share all this information with everybody, and we hope to see you at the Capitol this spring.
Awesome.
Thank you.
Thank you, guys.